Hi, my name is Jacqueline Losey, and I'm running for New York State Senate. Over the course of my career, I've had numerous years of exposure to our direct hands-on health care, as well as our healthcare system. I would like to take a moment and discuss a topic near and dear to my heart. The cornerstone of my campaign is our Medicare provisions for our baby boomer population as they become beneficiaries. The baby boomer group makes up 26% of our American population, and nearly 50% of those folks have incomes less than $22,500 on an annual basis. With our changes in the hospital reimbursement, quality incentives, and penalties, hospitals have had to look at ways to become more efficient and more effective. Preventing hospitalizations of a patient is key. When hospitals collaborate and work together with home care agencies, patient rehospitalization rates decrease. Just think, 36% of our seniors live alone with no support in the home, many of them with no family nearby, and limited community services as well. Home care definitely is imperative. The Medicare Payment Advisory Committee, MedPAC as they are known, has recommended that Congress impose co-payments for the beneficiaries receiving home care. The proposal suggests $150 for each 60-day episode of care. Home care co-payments have been in existence in the past. However, they were removed for several different reasons, one being there was not sufficient evidence to state that they ever had saved the government money. Nearly 52% of the Americans using home care have incomes below 200% of the poverty level, more than 3 comorbidities, and many of them are much sicker. These folks are already trying to decide whether or not to buy food, pay their bills, or get their prescriptions filled. MedPAC would also like to suggest to the Congress that they yet pass another decrease in home care reimbursement for services rendered. Currently, over half of the agencies providing home care are running in the red. We have seen the effects of our reduced reimbursement here in New York State with the dissolving of county public health certified agencies. Some counties have had the forethought and sold their agencies early, giving back to the county some reimbursement, while others who have just recently sold no longer have that available. The sales of these counties at this point do not generate an income. All that's exchanged is a certificate of necessity. Patients are moving to aging in place. They are considering staying at home, not wanting to go to nursing homes or adult home care. Many of our county nursing home facilities have also closed due to the fact that the reimbursement rates are low. This left a large void not only in our population of those folks who needed placement, but also to our workforce. Medicare is funded with federal monies coming from our Social Security, tax dollars. This is approximately 2.9% of our individual earnings. I would like to campaign to bring to the legislature a no co-payment for our seniors who are receiving home care services. But rather than to look at our Medicare as a source of a way to collaborate better with our hospital systems, I propose that home care agencies and hospitals work together to develop a standardized form of how to identify those patients at high risk. Look at the census at time of intake rather than wait until the time that the patient is going to be discharged. The group either should be looking at socioeconomic status, disease process and management, medications, lack of resources in the home, etc. Home care agencies should be offered an incentive if they keep their hospital rates reduced, as well as the hospitals. Hospitals and home care agencies should be given a benefit package for working collaboratively together. The reduction of rehospitalization will then fund the cost of what would have been from the co-payments. We need to develop care plans as to when a hospitalized patient should be considered as part of an involvement in a home care agency. A standard of practice should be put in place. Home care agencies should receive incentives for low hospitalization rates, but also should be penalized just as if hospitals if their rehospitalization rates are high. Incentives and loan repayments and options should be continued, as the need for nursing staff is also going to become a huge necessity with the influx of all these baby boomers. The Medicare and Medicaid system has undergone many changes. I find it very confusing for folks to understand, and for the consumers as well, besides myself. I find it extremely difficult to read into. Many interpret their coverage incorrectly. This needs to be simplified. Our national health care, with the Affordable Care Act, has brought about many changes, some of which I find very favorable. The electronic medical record use with the incentives for MDs to buy in, the medical home model, hospital incentives for quality, and the recovery of funds for poor outcomes. Joining in my campaign efforts to prevent legislation for Medicare co-payments for home care will be the political action group AARP, who are absolutely outraged by the proposed cost. In closing, I believe it is our moral obligation as Americans to take care and provide for those folks who once cared for us. This is a cost that our seniors cannot afford. I appreciate your time, and I hope that on Election Day you will consider voting for me. Thank you.